and I know our communication was fairly short term, but thanks so much. Let me just quickly introduce myself. I'm Wolf Kirsten. I'm one of the 3 partners hosting this event and the awards. My company is International Health Consulting. I consult most on health promotion and prevention and wellness with multinational corporations and also NGOs. But let's get started. I think we have a good, interesting webinar ahead of us. I'm just trying to get the control here. Tim, I'm trying to advance the slide here. All right, sorry about that. Okay, so this is the second year that the Global Healthy Workplace Awards are running, and we'll explain everything about them and how to apply, and hopefully some of you are interested in applying with your programs. As you can see here, our second actual summit, where the winners and finalists will be recognized, is in Shanghai, China next year in April 9 and 10. And I guess most important is that we're already ahead or in the running, I would say, with our award entries, as the deadline is January 24th. So we don't have much time left, but you will see the application process is fairly straightforward, and we hope that good programs will apply. And you can see here the website where it has all the relevant information. We will also have a recording of this webinar posted. And also I would like to say that if you have questions, and I hope you do have questions because we will leave ample time, that you can type them in on the control panel so we can see them, and then I'll start reading them out at the end and providing responses to that, either me, John, or Tommy. So at this point I also would like to, of course, thank the Institute for Healthcare Consumerism for hosting this. Thanks so much for doing that on a short-term basis again, so thanks a lot. And I'll hand it over to my partner, John Kamola, to continue.
Thank you, Wolf. Welcome, everyone. Let me echo my appreciation to the Institute for Healthcare Consumerism for their support and active engagement with us on this project. This, as Wolf said, is our second year, and I'd like to just give you a quick snapshot of the overview of what we'll cover in the call today. So the host and partners, Wolf mentioned, iGenius, International Health Consulting, and my organization, the Global Knowledge Exchange Network, came together really to recognize the globalization of workplace health. And what we're trying to do is create an opportunity for cross-cultural learning by bringing leaders and thought leadership from across the entire globe, which is the first that's ever been done, to highlight the emerging better practices in workplace health. We'll talk a little bit about the London Summit. We'll also touch on the 2013 winners, discuss the regional seminars, which allows us to take the messages and learnings from the annual event into different regions around the globe and share that with leadership on different continents. We'll also talk a little bit about the Latin American Summit that we held last August, September in São Paulo, Brazil, and we'll outline what we have planned and slated for Shanghai in 2014, along with the details around the application criteria for the awards itself. Next slide. Here we go. So this is really a comprehensive program, as I mentioned, and an opportunity to learn around the globe. And we saw a need for this kind of opportunity for engagement with employers and public policy experts, as well as academia and other parts of the system, to be able to understand what's working well. And so in so doing, we recognize in the awards itself large, medium, and small employers. We have support the awards with the annual summit each year, and we will also go into the regional series with seminars and mini summits, if you will. The content is all on the web page, as Wolf mentioned, and I encourage you to go there and learn more about the details of what we're doing and have an opportunity to engage. This presentation will highlight the successful outcomes of programs thus far and how you can benefit from future plans. Next slide, please. So good health is, so okay, we've posted over to host and partners. So you're looking at a slide titled Good Health Equals Good Business. And this slide really gives us an opportunity to talk about the model that we're tracking in the Global Awards, which is the WHO World Health Organization model of healthy workplace model for action. Wolf Kirsten was one of the principals involved in creating this model and brought it to our attention as an outstanding model for promoting workplace health. So we have tracked our awards to follow the criteria of the model. And you can see in the model in the big circles around the outside edge the four sort of buckets, if you will, that the model focuses on: the physical work environment, the personal health resources, psychological work environment, or psychosocial, I should say, work environment, and enterprise community involvement. And then you see in the little blue boxes that on the inner circle a continuous improvement process, and that's critical to the success of the model itself. So we have broken this into three categories. So we have three opportunities for you to apply for awards, and there'll be two finalists in each of those categories. The categories are large enterprises, small to medium-sized enterprises, and multinational enterprises. Next slide, please. So your host, a little more detail on who's involved. As I mentioned, this was the first time that we've had, or that there's ever been, we're back in London in April of 2013, the first time, that there had ever been a truly global workplace awards program. And in creating this, we were very mindful of the importance of it being a global opportunity. And so your hosts represent a knowledge platform that I think spans the entire globe, as you can see from the description of the three organizations at the top: GCAM, International Health Consulting, and iGenius. As your host, we were mindful of the need to engage other employer organizations and other NGO organizations around the globe to help us shape and mold the initiative. And so we are partnering with and have a standing advisory board of the International Association for Worksite Health Promotion, the International Organization of Employers, the International Institute for Health Promotion, the Health Enhancement Research Organization, and People in Aid. Next slide, please. So the Global Awards in London attracted a very broad base of stakeholders, and I'll just pause there for a moment for you to peruse the diversity of the folks who were involved, both as participants and as providing content at the awards itself. I'll mention while you're looking at the list that one of the things that is very important to us, and as a learning from previous work, is that we want to keep the participation in the awards itself relatively small. So the first event was a little over 100 people, and the event in Shanghai will target around 150 participants. It is an invitational process, and that we do that by design because we want to have an opportunity for the participants to learn from one another and be able to ask questions of the panelists and the finalists as we go through the two-day series. Next slide, please. So the winners and the runners-up in London in April of 2013 included Alexandria Health, which is a winner in the large employer category, Toyal America, a winner in the small, medium employer category, and then Royal Dutch Shell, which was the winner in the specialized program. The finalist, Johnson & Johnson, has a large employer category, Technica International, small to medium-sized employer category, and American Express in the specialized programs. So you see the diversity of different types of employers with different size businesses all participating in this initiative. Next slide, please. The London 2013 media coverage. One of the things that we were that was an unknown to us is the level of interest from the media in what we're doing, and so we were very pleased to be able to see that we had a very diverse audience, nearly 3 million people that came in and out of the process in London with multiple communication channels, as noted here, which included reporters attending the summit and wrote about it. We had CNBC, for example, and Wall Street Journal. We had the Platypus PR and MSNE Network, among others, who wrote about the activities in London itself. And the total readership of the publications and websites listed here as the multiple stories appeared in about 900,000. Additionally, the social media was an important part of what we're doing, in as much as what we're trying to do is to have a continuous ongoing communication platform, not just a one-time annual event. And so we were very focused on ensuring that we reached out through various social media channels, traditional ones that you're all aware of: Facebook, Twitter, LinkedIn, and so on, and also through media communication blitz, email blast, and other opportunities that were to reach out to folks and engage them in our work. Next slide, please. So the seminar series really is the extension of the global annual event, and it allows us to go into different parts of the countries around the globe and engage not only with the finalists and winners from the annual event, but also with various experts in different parts of workplace health promotion and wellness and well-being, and be able to bring those learnings to a regional platform, as we did in São Paulo, Brazil, last September, and as we have slated here in the U.S. Coming up in September as well for 2014. Wolf, I think I had slides 1 through 12, and I do not have a tracking to know which number I'm on at the moment.
That's the last slide that you can cover, and then I'll take over.
Okay, thank you very much. I appreciate that. So the São Paulo event itself took place on September 29th, and we were really invited by APQV and Alberto Agado to come into his country and to showcase not only what we learned in London, but to learn more about what's going on in South America, engaging in a variety of employers, large such as Kimberly-Clark and Dow Chemical and others that we felt were important to be able to learn from what we did in London. And so here we actually had the first regional event in São Paulo. It was very successful. I think we had somewhere around 80 people participating, and the room was set for 75. So we were pleased with the level of interest. It actually took place on a Sunday, which we were concerned about, in as much as that's a day of rest and certainly a holy day in that part of the world, and yet we had a very strong response to the invitation and engagement there. We did an overview of key health issues, including the Buck Global Survey, which Wolf will talk more about, and which we're actually happy to be sponsoring moving forward. It's a one-of-a-kind survey capturing the state of the state, if you will, of workplace health and wellness around the globe. We had presentations from the World Health Organization and the Pan American Health Organization through Julietta, and featured case studies of workplace award finalists and runners-up from the London event. and walked through how to implement the World Health Organization Healthy Workplace model itself, and attracted, of course, showcased three Latin American countries and examples of small and medium-sized enterprises in a pilot project that are taking place in Peru, Colombia, and Chile. I'll stop there and hand over to Wolf the details around how to apply and more content around what we're trying to achieve in this initiative. Thank you very much.
Yeah, thanks, John. Appreciate it. That's very good. I'd like to briefly stop here and give Tommy Hutchinson the opportunity to introduce himself. I see Tommy's on the line, I think, via the phone from iGenius. Tommy, can you hear me?
Thank you, Wolf. Hi, and apologies for being late coming on. I had some connection problems at this side. Yeah, my name's Tommy Hutchinson. I'm one of the three partner organizations, although a person can't be a partner organization, but my organization is one of the three partners, which is iGenius. We are a world community of social entrepreneurs. We have members in over 200 countries, and we basically promote social entrepreneurship, which is people who create businesses to do social or environmental good. And we have a training school called iGenius Academy. We organize events, and one of our interests in this whole field is to try to extend the practice of a healthy workplace among smaller businesses and also social enterprises. And we also play a role in marketing and branding of the Global Health Award. And we've been part of the GCAN network, I think, John, for about, I don't know, maybe 5 years, something like that. So quite some time. So yeah, so my apologies for coming on late, and but it sounds like it's all going well. Thank you, Wolf.
Yeah, thanks, Tommy. And just to add, Tommy and his group, while they're global, they're based in London in the UK, and I think bring a unique perspective to the awards program from a small and medium-sized enterprise and a very global network. So thanks, Tommy. That's great. Moving on, I just wanted to point out, before I go into a few details of the application process, I wanted to point out that these are really the only global awards program, or the global awards in the field, I would say. As you may know, and many of you may have applied to other awards programs, like in the U.S., for example, the Everett Koop program, and I'm sure some of you know that, and we have some in the U.K. and South Africa and Germany and so on. But there's not really, if a company is interested in getting recognition on the global stage, we're kind of filling that niche. And you don't have to be a global company, by the way. You can be a small company in Akron, Ohio, just to pick a city, wherever, and only have employees there. But if you're interested in getting recognition, if it helped you with your cause and your programs, this is the program to apply to. So I just wanted to add, because sometimes with the term global, people confuse or sometimes think, well, we have to be like a multinational enterprise. So I hope that comes through. It's clear through our three categories that we have. We have, as John already said, large enterprises, so in one country, so more than 500 employees, which it's not that large if you think about it. And then small, medium-sized enterprises below that number of employees. And then we have the multinationals, so the Johnson & Johnsons of the world, and so on. So those are the three kind of distinct categories, and we changed it a little bit around from last year just to respond to some of the comments that we had in the first year. And the second point, why I think this program is unique, is as John mentioned, we follow the World Health Organization Healthy Workplace criteria, and I will go into them. And they are fairly comprehensive, as you will see, and they don't only cover one area, like wellness, they also cover occupational health and making it integrated. But before I go into that, I would like to, again, clarify who can apply. So here you can see the cutoff point for the small and medium-sized and versus large is 500 employees, just so you know. Also important, again, just to mention it again, the large enterprises is within one country at one local work site. So let's say, to stick with the example of Johnson & Johnson, they can apply with their site in New Brunswick, or they can apply with their global program. So they can even do both if they wanted to. So there's no limitation on that. But we just wanted to make sure there's a distinction, because it's very difficult to compare like a multinational program and running in 50 countries compared to a small contained site. And that's the main reason why we changed it this year around. But again, you're welcome to ask questions regarding this, either at the end here or through email or as we move forward. So please feel free to type in your questions when you can. So here's the model again. The World Health Organization in Geneva at the headquarters developed this a few years ago. And naturally, they have a big interest in making this known and getting traction throughout the world as much as possible. And we're helping them with that. Just so you know, maybe somebody wonders why isn't the WHO logo on our material. They don't endorse programs where private employers are recognized, where they get awards. So that's just a policy of theirs. And we just have to work with that. But they've been very cooperative, as you saw earlier, being part of our events and helping us get the word out about this awards program. So without going into too much detail, given the time we have here, I want to point out that the model has 4 main areas. So you see the physical work environment on top, and to the left, the psychosocial environment, work environment, going down the enterprise community involvement, which is often looked at as corporate social responsibility. At least that term seems to resonate better with the larger enterprises, but the WHO decided to call it enterprise community involvement. And then the personal health resources, so that's more your traditional wellness program. What do you do in nutrition, in physical activity, tobacco cessation, and so on. And these areas have to be, or should be, integrated, so they're not like standalones. As you know, sometimes an occupational health program, like occupational health and safety, is detached from your wellness program very often. Or maybe human resources run your wellness program, and your occupational health and safety is run by your health services or your medical physician, your occupational physician. So that's important. That's important. There's some linkage and there's some integration with your programs, all coming together to make it a healthy workplace. Also, very important is the center image here. First of all, leadership engagement and worker involvement. That's important. So it doesn't just come from the top, that the workers are involved, the employees from the get-go, and to determine and help build the program. And then the circle around it, as you see, is a continual improvement cycle. And I think most of you are familiar with that. While it may seem basic, we all know it's not that easy to actually implement. But very important, lots of programs that I know do not follow this. They do not evaluate. The global survey from Buck Consultants, which John referenced earlier, has a very interesting statistic that only about a third of the respondents of the, I think, 1,500 employers from, 50-some countries, only a third say they evaluate their programs, which is really mind-boggling, as probably the respondents are more advanced than companies who don't offer any programs. So there's a big need for evaluation. And at the same time, of course, you need to assess up front and so on, mobilize and assemble. So I think that's important. And I think in the applications, it has to come through. While I understand that not every enterprise or employer can deliver like some really solid results, whether it's return on investment, which is very difficult to prove, by the way, or other health-related outcomes, you need to show that you have a plan. So maybe your program is still relatively young, but that you have a plan in place to evaluate and how you plan to do it moving forward. And maybe you have some preliminary results. Maybe these are participation rates, so that they're not always health-related. As we all know, it takes time. It takes time. I just wanted to drive home that it's really important to follow this continual improvement process and make that clear in the application, and you'll see the questions are reflect that. I wanted to point out the global nature of the awards program. As I mentioned earlier, this is really the only global awards program. You'll see it reflects all the way through in all our communication materials, in our participation. We had applications from 28 countries in our first year. So again, it shows you it's not just North America, it's not just Europe, Africa, Latin America, Asia, all over the place. So that's really key for us, and I think with us three partner organizations, we can cover the globe, so to say. But not just us. Obviously, we have our advisory board, and then we have our judges here. So as you can see, representing 5 different continents. So from the UK, from the US, from Singapore, Brazil, and South Africa. And I think very glad to have them on board, and they will be on board for the second year as well. And they did a great job, kind of finding, working through those applications and deciding on finalists and then finally a winner. It's not easy, I tell you. There's some very, very good applications or companies participating, and it's really not easy to come to a final winner, I think. Okay, I went one too fast, I think. Yeah, okay, so these are the 5 keys to healthy workplaces. This is basically another way of reflecting or explaining the model. And I will go through these keys one by one, but try to keep it to time frame to give you time to ask questions. So leadership, commitment, and engagement. I think that's really important. I mentioned that. I think there's plenty of research out there and reports and so on one of the main predictors of success of the program is having your leadership, your senior staff being supportive, being actively involved to support the workplace health or healthy workplace program. I think that's really important. Also important if they have a policy which is dedicated to promoting the healthy workplace. Leading companies usually have that. And then a question around are the healthy workplaces activities integrated? As I mentioned, the integration issue is very important. So these reflect the question from the application. Next one is worker involvement. How are workers involved in the planning and program process, beyond just participating, obviously? Has your program promoted diversity and gender equality? That's also a very important issue driven by the WHO and many other organizations, of course, as well. And let me pause here and say that these 6 questions, which present the application, you have there's a limit of 500 words per question. So that's not easy, because I have here be as specific as possible, while you're only allowed 500 words. So that's a little bit of a challenge, I know, but we have to draw the line somewhere. We had a few applications last year where we had, I don't know, 90 pages or something, and they obviously didn't follow the guidelines, but we discourage any kind of attachments, so we're not going to look at those. And, we just want the application, 500 words per question, and trying to be as specific as possible. And if there's follow-up questions, the judges will pose them, just to make it manageable, for both sides, for the applicants and also for the judges, to make it manageable. Okay, I think I drove home that point, how important it is to follow the continuous improvement cycle, with the assessing and then evaluating. I think that's part of really important part of the model, and that's part of the question in the application, as you see here. Specifically, which processes, outcomes are measured, and demonstrable milestones have been achieved. So again, if you have those, please mention them, and that we all know about them, the judges know about them. We did add a few elements to the process, to the criteria, which are not directly featured in the model, but which are in the spirit of the healthy workplace model. And one of them is innovation. We always, of course, want to highlight and recognize innovation. And that's part of our entire mission of our program, is to share these innovative approaches, so other people, other organizations can replicate them where possible. I know it's not always easy to replicate, but there may be elements which can be taken from one country to the other, from one organization to the other. So innovation is, I think, is a very important component of this awards program. And then, of course, sustainable. Excuse me. I think that's very important because a lot of programs are not sustainable. We still see that very often in hard economic times. Programs are cut. Wellness programs, health promotion programs, you know, they receive budget cuts. Some are even slashed totally. It still happens, unfortunately. So that's important. How is the initiative, the program, considered sustainable and promoting lasting health improvements? I think that's an important component. Moving on, I think the last element is replicable. How would you judge the ability for this initiative to be replicable beyond its current form? Again, that goes back to one of the most important goals and our mission of the entire initiative. Can it be scaled, implemented in diverse environments? So if you may have a very successful program, but if it's so specific to your environment, and it's so hard to transfer to others, you know, that would probably reflect negatively on the evaluation scorecard. So I think that's important because we really believe in that. You know, we want to help and give companies the chance to share their success stories. And a lot of companies, enterprises are doing this already. You know, they have a mission within their own program to share it, you know, and help other enterprises to get to the same level. So we firmly believe in that. Here are some basic requirements. And then I think we're slowly coming to the end to give enough time for questions for you. So all applying organizations adhere to workers' social and ethical codes as part of their role in the broader community and enforce occupational health codes and laws. Now, I think for many of you, hopefully, this may seem, you know, basic or a given. But I tell you, there's a lot of companies, enterprises worldwide which do not do that. And occupational, and it's not just in developing countries, also in Europe, in the US, we hear about this nearly on a daily basis. Occupational health laws are violated, you know, happens frequently, unfortunately still, and so we definitely do not support that, obviously. Applicants can be any kind of organization. They can be private, public, non-profit, can be a government agency, you know, as long as they have a health promotion program, or I should say a health workplace program for their employees. We've had some organizations apply, which may be vendors, providers, and while they may do a great job, you know, they cannot apply unless they have a program for their own employees. Again, that's kind of the nature of the awards program, which we are driving here. Programs are based in the workplace. That's what I just mentioned. Applicants must be willing to provide information on the Global Awards website and other outlets selected by the host organization. So, of course, we work with the applicants and the finalists and the winners in terms of what kind of information is shared, but then there has to be a willingness to share that information. Again, it goes back to the nature or the mission of the entire program. If you know, if a company just wants the award and wants to keep all the information for themselves, you know, then they should not apply, I think. Applicants must be willing to participate in ongoing profiling for a minimum of 12 months. And that goes kind of hand in hand with the previous point, for example, at regional seminars, newsletters, and on the website. So, of course, you know, we can't mandate anybody to come to a regional seminar, but again, that willingness needs to be there. And most companies are very, very eager and very open to do that. I think it helps them, it helps others. So it's an open sharing process. Applicants will not use supporting materials with their application. Now, I know that a lot of companies want to do that, and many have some really good marketing materials around their programs, but we really kind of discourage companies from doing that because it kind of makes the entire process, the application process, not manageable, unmanageable. So I think I said that earlier. And then I think which is another unique point of the entire awards program, which John mentioned earlier, is that the finalists, you know, 2 per category, will be invited to attend the global award summit, and it kind of makes it exciting. It's kind of a showdown, if you want. They make their presentation, they explain their case study, and then the decision is made on site. So the winner is not determined beforehand. I think that's important to point out. So the judges make the decision on site. Excuse me. And for that, no videos are allowed, because we had that question a number of times. It's a straight up PowerPoint presentation, or 20 minutes, and you have to make your case without any kind of fancy video. So that's just a few basic requirements, and there may be more questions about this, but I think we've made our best effort to keep the application process, again, manageable, user-friendly. So I know people are busy, that they don't have to, write pages and pages to be eligible to apply. So I think I'll leave it at that. I'm going to open up the floor to both John and Tommy if you want to add anything which I have missed at this point.
No, I think not. I think you've covered everything very comprehensively.
No, I don't have anything else to add specifically, no.
Okay. So before I open it up for questions, as you can see, the deadline is coming nearer, January 24th, and we started back in November, and most of you probably know about that, or maybe not, but we've been broadcasting through our networks that the second year of the awards program is open, and since November. But obviously, with the holidays, it's always tough, and how these how it goes in terms of their applications. So that we knew that we were going to run into that, but obviously there's a planning process in place, and we need to get ready for China, for Shanghai, in April. So just so you know, that's the application deadline. And you see our emails here, so feel free to send us a question, any of us or all of us, and we'll respond, right away, pretty quickly. So we will help you with your application as much as we can. I think that's what we've done in the past, and we'll continue to do so. So I think I'll open it up for questions. Please take the opportunity to ask any. So this is your chance, to do it in person, so to say. So at this point, I don't really see any questions on the control panel. I don't know, Tim, if you see any, let me know. I don't see any at this point.
Walt, this is John. I just wanted to mention while we're waiting for those to type in their questions, that the length of time that you anticipate, or we anticipate, an applicant to complete the application process. I believe we had polled some of the applicants, and it was about a 2 to 3 hour process. Is that right?
Yeah, I think so. Of course, it depends a little bit on the employer and how well they're organized. For some, it's a big challenge to pull together the information. For others, because they've done it before, or it's quick. But I would say so. I mean, if you have a fairly good overview of your healthy workplace program to begin with, I think 2 to 3 hours is realistic. If obviously, if you have to start to pull together information from all different kinds of elements or component or sections of your company, then yeah, then it may be a little bit longer than that.
Could I just perhaps suggest, Wolf, on that while we're still waiting for questions, that always with this kind of thing, it sounds obvious, but it sometimes doesn't prove to be, but encourage people to actually answer the questions. We do get applicants in the past where people kind of cut and paste stuff they have previously written, and sometimes that isn't relevant or directed to the question that's being asked in the application form. So we'd really encourage people to study the form as they're going through. It's not difficult. We've tried to design it in a way that is easy for almost everyone to fill out. And so but it is important that people address the questions that they're asked. Also, the small business category, a reminder on that whilst we encourage, we do know that quite commonly small businesses will often not have the same kind of resources that a large corporate would have and so on in designing programs. So we don't require them to have covered all of the areas of the criteria, but we expect them to require to cover at least one of them to a good degree of satisfaction and beyond and have a signal to cover the others as well. And probably just the third thing I would say is that, and I'm sure it's been stressed continually in the parts that I missed at the beginning, but it is a truly global program, and we do get entries from all parts of the world. We had entries from 29 countries in the first round, and they were of all both developed countries, developing countries, and so forth, east, west, north, south. So these awards programs really do apply to everybody. That's the intention of them as well.
That's a great point, Tommy. Let me just reinforce that. While we, of course, want employers to follow the healthy workplace model and show that they have implemented programs in these 4 areas, of course, you can apply if you think you have a good program, obviously, but you can apply even if in one of the 3 or 2 of the 4 areas you're not as strong. One area is the psychosocial work environment, and I don't think we have the time to explain this at this point. But if you go to the WHO, first of all, if you could go to our website, again, globalhealthyworkplace.com, you will see explanations and a link to the WHO website as well. So I think that's important. If you feel like you're not really sure, what does it mean, psychosocial work environment? So that's a term which is still not totally clear, and where I think a lot of companies haven't done such a good job in the past. So I encourage you to take a look at that on our website and then on the WHO site. But just to reinforce Tommy's point, some companies, especially SMEs, not always, but sometimes, they may not have mature programs in all 4 areas, but they feel like, well, we have a really good program regardless. And then also, I should mention that the plans, you may not have a program in place, but you're in the planning stages, or at least you are looking at that one of the 4 areas to cover that, so to say. So rather than just totally ignoring it and say, well, we just do wellness, so to say. So that's, I would include that in the application, at least a willingness, or even if you don't have a mature program in place in those areas. And don't forget the physical work environment. A lot of companies have very good occupational health and safety programs. That should go in the application. Mention it, and some have good stats on that too in terms of accidents and injuries and so on. So don't make it the priority, but put it in there if you have that program. I think that's important. It's not a given just because it's mandated by legislation. So I just wanted to point that out. But thanks, Tommy.
Wolf, do you have? Can someone flip the slides back to the slide that has the URL address of where you apply for the awards and where you go to learn more about the awards? I know the slide we're on doesn't provide that, and it might be useful.
Yeah, Tim, can you take us back to that?
There we go.
Yeah, I saw that was a question, and I just picked that up. So the website address, so globalhealthyworkplace.com, obviously gives you all the information. Then if you go, you can go straight from the homepage to the awards program, or you application, or you type in awards Shanghai 2014 as well. So it'll take you there. And again, it's fairly straightforward. In terms of takes you right to the application, and then you can submit it once you're done. Okay.
Terrific.
Okay.
We have several questions that have been coming in. This one's from John Greenstein, and he asks, what does it take to win the multinational award?
Yeah, it's a good question. First of all, the same criteria apply, of course, that I mentioned to any company. And then I think important is for the multinational category that you have some global traction. So it may seem obvious, but so let's say it's a U.S.-based multinational, and you have a very solid, mature, proven program in the U.S. But what about the other countries? Do you have a pretty good distribution, I guess, or spread to the other countries, and do you offer areas and the employees have access to them? So whether it's in China or in Brazil, depending on how big you are, I think that's important to drive home that point, that you have a good reach, a good global reach with your programs, and maybe some global standards along that process. Yeah, that's just really in a nutshell quickly, but I think that's the most important part, that it's not just one country or two countries, and that you really have some good global reach.
Good. And we have Carol Vickers.
Can you have a question? Go ahead.
Carol Vickers asked, how long is the in-person presentation?
I think it was another 20 for Q&A, because we do give the judges and the audience too, but of course the judges first, a chance to ask some key questions which they may need to know the answer, and need to know to make a decision. So it's 20 minutes. I know it's not long, but again, it's part of the challenge to summarize your program in a short time frame, and then 20 minutes Q&A, I think.
Okay, we have another question from John Greenstein. Yes, can you expand on what would be incorporated to the psychosocial work environment? What are some best practices from past winners?
Well, yeah, great question. There are actually some awards programs which specifically in the U.S. look at this area, like Psychologically Healthy Workplace Award program. Another one is I would encourage you to take a look at is the UK, the United Kingdom Management Standards for Work-Related Stress. So obviously stress has a lot to do with it. And they outline 6 main areas in terms of, I won't go through all of them, but in terms of the demands placed on an employee, what kind of control they have over their work, maybe relationship with their co-workers, what kind of to make the work environment a healthy one, because as you know, and we'll probably agree, a lot of stress is caused by how the work is organized, and some workers are really put in a very difficult position, especially control to fulfill these. So that's been researched for quite a long time. And the interesting part about this area is that now some legislation is coming out in Canada, in the UK. Obviously, in the UK, it's been around for a while. In some other European countries, kind of looking at that. So, in terms of risk management, it's not just about your physical workplace, but also about the psychosocial elements. So it's not just about the noise and light and all that, but actually about how work is organized, because as you know, the mental illness rates have gone up incredibly. Of course, it's not all due to the workplace. I mean, a lot has to do with the individual person, so it's sometimes hard to distinguish between those. But I think it's shown and documented that the workplace and how work is organized, how your supervisor treats you, plays a big role. A big role in terms of your health. So I hope that answers it to a little bit. If you follow up with an email, I can point you towards like the Canadian standards as well as the UK ones, that will be helpful.
All right, and we have Dr. Ashish Demarju from India, who asks, could you provide a little more clarity on enterprise community involvement?
Yeah, good question, and thanks for joining from India at this time, this hour. Thanks. Yes, that area, I try to equate it. I shouldn't totally equate it because the WHO, I know, doesn't like that, but with corporate social responsibility. And I think it's important. How are you involved in the community, and not just as an isolated event, like funding something or sponsoring something like a community facility or something like that. But how is it linked to your health program? Like, for example, do you provide? These are just some examples. It doesn't have to be that way, but do you provide any kind of screening for beyond your own employees? Maybe you start with the dependents. I know some companies do that anyway, or to a wider community where you are located in. Any kind of programs that you offer, do others have access to it? So I think that link between the health program just for your employees and the wider community to show that, I think, is very important. And that also means, for example, kind of sharing some of your best practices, your success, with other organizations in the community. So it could be a wider community, not just a physical community around you. So that's I hope that helps a little bit. Again, I can refer you to the WHO website, and again, you can go through our website because they explain it in a more comprehensive and better way. Okay.
We have another question from John Greenstein. What does it take to win the multinational award?
I think I answered that earlier. I hope that doesn't mean that I didn't answer it very well. I think I answered in terms of multinational category that you should have some global reach, not just in one country.
Okay. And following up with you, Ashish, does the program conducted for employees, if made available for families and dependents, accepted under this element?
Yes, I think that's part of it, as I mentioned. I think that's good, because that shows that you're kind of expanding your program beyond the workplace per se. Yes, I think so.
All right. And I believe that's it for the questions for you guys. Thank you all.
Yeah, okay. Well, I think we're nearly at the end anyway, and I just would like to point out at the end here that we do have another webinar next week on the 14th, and not that you would join again necessarily, but maybe your colleagues, and it's a little bit earlier time because we want to make sure that we get more of the European audience for a better time, and hopefully also with Asia. So that's next on the 14th, and I think it's 4 hours before, so it'll be 7 a.m. Eastern time, which is, 12 p.m. I think, 12 noon GMT in London. So I will close, but I'll give John and Tommy anything you want to add at this point?
Just if it was mentioned, for small businesses, there is the winner also gets a £3,000 prize.
Dollars, right?
Dollars.
Yeah.
Oh, John?
Yeah, that's good. Thanks, Tommy. That's important to mention that. John? Anything?
No, I really don't have anything to add other than I'm very grateful for those who are on the call, and hope that you'll apply, and please do take Wolf or myself or Tommy up on the offer to follow up by email. We would be more than happy to clarify and help you in any way we can to put your best foot forward.
Great. Well, thank you, everybody. Thanks again to the Institute for Healthcare Consumerism and Tim and all of you. Thanks for setting this up, and thanks for everybody for joining. And look forward to your applications. Thank you.
Thank you.
Bye-bye.
Bye. Bye.